try to curb the use of dry foods, because dry foods tend to have a lot of preservatives in it, which hurt beneficial microbes in the mouth that are there to protect the cat. So if they're being obliterated by the cat food on a daily basis, they're not there to protect against these harmful organisms that really want to invade that tissue and cause problems, right?
Welcome to the Pet Care Report podcast by Pet Summits. Here's your natural cat healthcare host, Dr. Meghan Barrett.
Hello, everybody. Thanks for signing on to the Pet Care Report. We've got a very special guest today, Dr. Emily Stein. I'm super excited to talk to her about dental and oral health for cats. So thanks for coming on the show, Emily.
Awesome to be here. Thanks.
So Emily brings a unique scientific background in molecular biology, microbiology, cellular immunology, and rheumatology. She completed her postdoctoral fellowship in the Department of Immunology and Rheumatology at Stanford University, where she studied the role of the neuroendocrine immune axis in autoimmune diseases. So we will be talking today about decoding the oral microbiome in cats, inflammation's role in dental disease, and some prevention and management tips for cat owners. All right, so to start off, could you help us to understand what the oral microbiome is and why it's crucial for a cat's dental health and overall health, please?
Absolutely. Okay, so a cat is outnumbered in cat cells by microbes that inhabit it. They coat cat's fur, skin, mouth lining, tongue. They're in the salivary glands. They're even in the bone. They're the GI tract. They're in every tissue because when they are developing in utero in their mama, in the womb, microbes are present in the womb and kind of co-evolve together and help guide the developmental process. And in a sterile environment, yes, cats still can develop and have live birth, but those kitties are not as healthy in a sterile environment, and which shows the importance that the quote unquote microbiome, which is the bacteria, the fungi, the viruses, the archaea, that sometimes the parasites that are all part of that invisible layer of information, cellular information and influence that drive kind of cats' development and well-being and throughout life too.
Definitely. So I know that the oral microbiome in particular is a less talked about and less understood area. So do you think that it influences a cat's health to have a healthy oral microbiome?
Absolutely. What I can tell you is that the cat's GI tract, the GI tract in a reptile and a mammal spanning all animals is a hole in a hole. One is the opening, one is the end. And the inside of that hole is the outside of the body, technically, which is coated with microbes that are literally feeding off of what we all ingest. So for cats, hopefully they're on a really high protein, low fat diet, hardly any carbohydrates at all. And that selects for the microbes that inhabit that compartment. In the mouth, it's called the oral microbiome. And the oral microbiome is in charge of immediate feeding. And they're in charge of usually maintaining a healthy barrier function in their host because they're incentivized. They do well when their host animal, in this case, the cat, is actually doing well and is protecting them and is providing a mutualistic kind of relationship. And so they'll start to do immediate metabolism on simple amino acids that are present in the cat's diet, and they're able to survive, and they're able to help protect against harmful microbes that always want to get into that space because it's hot, it's moist, it's a great incubator for certain kinds of microbes that tend to behave badly and or cause problems. And then the beneficial microbes, if they're there in the mouth of the cat, will get swallowed. And they'll help seed and maintain beneficial gut populations downstream in a cat. And so that's why one of the main reasons why oral microbiome is so important, not just in oral maintenance of oral health, but also in downstream gut health.
Yeah, definitely. It's kind of like the first area of the internal microbiome that if we interact with food and other substances, they're like our first line of defense.
Absolutely.
Yeah, we see a lot of issues with cats and dental health in the clinic. And so I think it's a hot topic of, discussion and frustration for cat owners of how do they best take care of their cat's teeth. And for those cats that don't like their teeth brushed, what can be done to help to manage and maintain their cat's oral health?
Yeah. Yeah, I mean, well, honestly, about 2% of American dog owners brush their dog's teeth on a regular basis, and like less than point something percent of cat owners, right? Because we all know cats like run away the minute they see us, like coming after them with something that's going to go in their mouth. That's not a treat. So it is very important to do whatever we can, I think, to facilitate the growth of beneficial microbes and decrease the likelihood that harmful microbes are going to come in to that cavity. Because once they're there, it's really hard to get rid of them, honestly. And so there's some very simple things that can be done. And then there's more complicated stuff that we're finding out. But the cheap, simple things to do is to literally take that water dish or the water feeder, whatever people have, throw away that filter, because the filter we find does not work and actually causes problems. Put it in the dishwasher at least twice a week. Go through the sterilization cycle. So soap and water are your best friends. Wash repeatedly. And if cats really like to drink from the water faucet, make sure that water faucet is cleaned on a regular basis, because our drinking water isn't clean. It's not sterile. So it doesn't have things that cause diarrheal diseases in it, which is how it gets through the municipal release into our drinking water. But it does have certain microbes in it and fungus. And what we find in cats with gingivitis and cats with stomatitis is that they have an insane amount of fungus in their mouths. And based on our testing of people and pets and their drinking water sources, we think that a lot of it's originating from their faucets. Definitely close the lid on the toilet. Don't let cats drink from the toilet. Don't let cats. I know. Don't let cats drink from the kitchen sink unless you clean it with bleach on a regular basis, because there's a ton of fungal spores in the kitchen sink. Wash the water bowls on a regular basis. And as importantly, is to try to curb the use of dry foods, because dry foods tend to have a lot of preservatives in it, which hurt beneficial microbes in the mouth that are there to protect the cat. So if they're being obliterated by the cat food on a daily basis, they're not there to protect against these harmful organisms that really want to invade that tissue and cause problems, right? And the second thing is a reason why to kind of use dry food only as a treat or very periodically is because there's a heck of a lot of carbohydrate now in these foods, and that's the filler that they're using. So it's corn-derived, wheat-derived, rice-derived, chickpea, you name it. It's all carbohydrate, and that tends to really enrich for the kinds of microbes that cause problems, like fungus, like Porphyromonas, like some of these other microbes that are linked to kidney problems downstream. And so it's really important to kind of curb that influencing factor in your cat's mouths.
Yeah, definitely. And I know that you've developed a product that is a probiotic for the mouth. Can you tell us a little bit about that?
Yeah. So in our findings, we found that it's most important to drive the kind of metabolism of the microbes that are inherently in a mouth whether or not they're good microbes or bad microbes, we're going to force them down a road of certain kinds of metabolism. So particularly for cats, cats are normally carnivores, right? They don't normally eat vegetables or herbs or grains. That's like super foreign for cats, and their digestive tract is not at all set up to digest those materials. But recent trends in cat treats and cat foods really has a lot of filler that's carbohydrate rich, and we're seeing that's completely shifting the oral microbiome, increasing rates of gingival inflammation and tartar and plaque production in tooth loss in cats, chronic kidney disease, and then also gut problems lower downstream. And so what we're doing is literally putting the oral microbiome on a keto diet through nutrition. So we're giving a postbiotic made by soil bacteria, which stops the global oral microbial community from taking up sugar. So they're blocked in eating any carbohydrate that's coming in on a diet. And then simultaneously, we're stimulating the bacteria. The beneficial microbes tend to be able to do this, particularly for cats, which is super important, to eat and break down protein. So that we're basically forcing them on a keto diet, which is what cats eat normally, right? And so by doing that nutrient pressure, we're forcing change in the mouth. And we're selecting for microbes that should naturally inhabit the oral cavity of cats because they are majority, protein eating animal. And they need to have a microbiome that matches their diet and matches their historical genetics, and not something that's shifted based on economics, right? Because it's super cheap to make and manufacture cat food that has a ton of carbohydrate fillers these days because protein is so expensive. But the problem is that doesn't match onto the cat's genetics, and it doesn't match onto the historical inherited microbiome. And when you get an imbalance in any of those, you get problems downstream like inflammation, kidney disease, cancer, tooth loss. And that shortens cats' lifespan and really decreases their quality of life.
Yeah, definitely. Yeah, and you mentioned inflammation. So that's a term that we hear quite a bit, but might not fully understand. Can you clarify how oral cavity inflammation could contribute to cat dental diseases and other systemic diseases?
Absolutely. So dogs, cats, humans, non-human primates, horses, we all have lymph nodes that are constantly that are full of immune cells under our chins, along our necks. And their job is to constantly sample their environment. All mammals have a ton of lymph nodes by our mouth because they're constantly sampling what we're eating and what we're being invaded by, because this is the biggest open area of access to the body. And so you usually see inflammation in an organism in the mouth region first, because it's the first point of entry, and it's the first point of breach if there is some kind of an invading microbe that's trying to attack us and gain access to the rest of our body. And in cats, what we're seeing is gum erosion, particularly in the molars, because you get this outgrowth of plaque and tartar. Because cats don't salivate enough in the cheeks area and around the molars. They tend to salivate on the tongue, where they have these tiny little hairs. We've all been licked by cats, so we know the scrapey feeling. But those are these tiny hairs on their tooth surface, on the tongue surface, and behind those hairs is actually a little tiny pool of saliva on every single hair. And as cats age, saliva rates go down. So inherent in the saliva are naturally protective molecules that are made by the liver and other aspects of the cat body that kind of help contain the microbes that grow in their mouth. And as cats age, those levels go down. They don't salivate as much. all cats, doesn't matter if they're kittens, they just don't drink a lot of water, and that doesn't flush the oral cavity as well as I would like, because microbes create toxins and they secrete things that cause inflammation constantly. And so you've got all these sampling immune cells and cats' behavior, which they don't drink a lot of water inherently, right? And they're licking constantly their paws and their face, and they're grooming their, if they're raised by other animals, they're grooming those guys. And so they're taking in that microbial environment constantly into their mouth, right? And if it's a harmful, pathogenic environment with microbes that aren't beneficial, and there's a lot of spores because you're living on the coast along, water and a moist, humid environment, there's just a lot that cat is taking into their mouth. And if they don't have a healthy ecosystem and they're not drinking enough water, they're just not able to flush as much, which means that their innate immune system becomes highly active in a chronic way, which leads to chronic inflammation, which is not good for the cat.
Yeah, absolutely. We see so many cats with gum disease and, all the plaque on their teeth. And I think that one thing people also don't understand is that since cats are carnivores, they have more of the pointy teeth for shredding meat, and they don't get cavities like we do. They tend to get more issues with the periodontal areas, which is the root tooth attachment. And so as the plaque builds up along the gum line, it pushes the gums back and causes recession, and they get pockets around the teeth where then bacteria can sit and live. So I think not only are people unaware of that, they're also not looking in their cat's mouths. So a lot of times they don't even know until they come into the vet. The vet looks in their mouth and is like, whoa, there's a lot of tartar in here. And it often comes as a big surprise. So I think those, annual vet visits are really important for cats to get those checkups. And also if owners are able to check their cats' mouths too, and at least, do some of the simple things like gentle brushing, or even just, applying a little bit of coconut oil or something just to get more moisture into the mouth, especially for the older cats. Those can be really helpful things to do too.
My favorite is actually just to rub the cat's gums, because that stimulation alone, just with your finger, that stimulation alone will increase circulation and remove a lot of the toxins away from the tissue, if you can.
Yeah, we take for granted too how much, everyone thinks that brushing the teeth is for the tooth, but a lot of it is actually for the gums, to bring the blood into the tissue and to stimulate the circulation there so that it's not just stagnant and has never been touched by anything besides some kibble scraping at it once in a while.
Mm-hmm. And kibble doesn't really do the job that it's touted to do.
I agree.
In all of our studies, it's always been the lowest on the totem pole as far as benefit goes. So
I do think it's a bit of marketing that it's held in such high regard for cleaning teeth, which I always compare it to eating pretzels or chips. Like, that does not make my teeth feel cleaner in the end.
Yeah, it's a little fuzzy at the end. That's because you just fed your microbes a ton of carbohydrates.
Exactly.
Yep. The other thing is that cats don't show pain as easily, or it's really hard to see that they're in distress, especially from a late stage perio standpoint. They tend to not show that they're hurting much, and they might just decrease their water intake or their food intake, and that can be a sign and you need, people need to go to the vet right away if they see that.
They can be very stoic about it. Or if you see salivation, sometimes they'll actually be salivating from pain. So any of those weird food symptoms or oral symptoms, definitely come in for a checkup right away to see your vet.
And the other key thing to know is that sometimes cats are addicted to corn and corn-based stuff, and I don't know why. I think it's the microbes that they have inhabiting their gut, because what we now know about microbiome is that who lives in your gut dictates what you like to eat and your food
and what
preferences.
You crave.
Yeah, cravings. So cats, dogs, humans, non-human primates, horses, cattle, pigs have been studied. So it's cat and rats and mice. So it's pretty universal that who we have in our GI tract dictates what we're craving. And there's sadly a lot of cats that are drawn to corn-based products, and they should never come into contact with corn or wheat or rice or chickpeas or, you know what I mean?
Yeah. It's like feeding our cats little Doritos is basically what kibble is.
With crack inside.
Yeah. I know. They call it kitty crack for a reason.
Yep.
Okay. So besides being on a high protein, moist diet, what are some other actionable steps that cat owners can take to manage, prevent dental disease and keeping these inflammation and microbiome factors in mind?
Yeah. Okay. So, if you have a mixed household, meaning you have cats, dogs, or cats and children, what we found molecularly and microbiologically is that there's this massive exchange in microbes around the household. So my biggest and easiest and cheapest suggestion is to make sure everybody in that household has dental hygiene practices that they utilize on a daily basis. For cats, that's obviously difficult, and that's where, products like ours come into play on a daily basis. But it really has to be daily, because if you even go off for like 3 days, those dental pathogens, the fungus that causes stomatitis, we feel, or periodontal disease bacteria really start to creep up, because it's the microbes are transmitted within a household.
Yeah, definitely. So if anyone wants to try your product, tell us where they can find it and how it's administered.
Yeah. So they can go to teefhealth.com. It's TEEF, health.com. And right now it's a water additive. And it puts the microbes on that keto diet, like I mentioned, but we also add in an extra tool in the arsenal to combat the fungal problems that we see in stomatitis patients. So in fungus, which is, the mouth of a cat, moist, hot, a great incubator for fungus. And because there's not a lot of saliva production, they're not rinsed away. So they really take hold. And then they secrete a bunch of neurotoxins, neurotransmitters, immune modulators, things that cause tissue overgrowth as a response. So that's why cats can have super painful gingivitis and stomatitis. And so we figured out a simple, non-toxic supplement, which is chlorella. It's a algae, but it's the cell wall material, which is like a molecular sponge that really binds these toxins and neutralizes them and just passes right through the GI tract of the cat. So the cat doesn't see those. And then in the meantime, we're sugar starving the fungus from growing. And so that's our approach. But it's added to the drinking water. We're coming out with play toys in the next year for cats, and any way to get it in their mouth as frequently as possible. You can even put it on their wet food. It will definitely help their gut health, and it will have a benefit in oral health, but we have to figure out a better way to have it stay in the mouth before they swallow. So we prefer water additive, but you don't have to just limit it to water.
That's great. Yeah, I use it for my cats, and I can tell you that it does not seem to change the taste of the water. They still go for the water bowl, but it's also a good reminder for me to wash the bowl every single day and put a fresh dose of the product in, because it does give it a tiny bit of a yellow-green tinge, and I think that's from the chlorella, right?
Mm-hmm. Yep, and the vitamin B6 is the yellow, and the green is the chlorella.
Yeah, so I've used it. I've tried it. I think it's a great option, especially for the cats that won't let you anywhere near their mouth. At least so that you're doing something proactive in between your vet visits and veterinary dental cleanings to really do a deep cleaning in the cat's mouth every couple of years or so.
Absolutely. And all of our molecular testing and microbiology data are showing that as long as you really improve that oral microbe population in the mouth, there's going to be systemic benefits downstream, not just oral benefits. It might not be super obvious right away, but on the molecular and microbiological levels, it's very obvious pretty quickly within about 2 weeks.
That's awesome. Yeah, I think it's definitely the healthier your mouth is, the healthier the rest of your body will be. And sadly, the cats that come in that are really ill tend to have a lot of oral issues going on. So I think supporting both is a great way to keep your cat healthy and living for a long time.
Yeah, that's the goal. Yeah, my little guy lived for 19 years, so
that's amazing.
I hope everybody's kitty gets to live about 20 to 25.
Yeah, definitely. Do you have any last tips that you would recommend for pet owners to go away with today and implement?
No, I mean, the best one is just to kind of, just to work with your veterinary provider as regularly as you can. And because it's a daily war against these microbes, right? And it's not an easy fight, and we're still learning more as we go, and we'll share what we learn. But it's going to take a village to really drive the change that's needed for feline dental care.
I agree. Yeah, I think just trying to think of it as more of a way that you can support your cat rather than a chore to have to think about their mouth. And I keep my cat's little toothbrush next to mine so that when I brush my teeth, I try to remember to brush theirs, because for some reason it's really hard for all of us to just make it a routine. So just know that any brushing and oral care you can do is really beneficial for your cat. So just try your best.
A little bit every day goes a long way.
Yes, absolutely. Well, Dr. Emily, thank you so much for your time. Where can the audience learn more from you on the internet?
Yeah, you guys can email questions to info@teefhealth.com, or you can look at our YouTube for Teef Health. I think it's at Teef Health, where we have a bunch of informational lectures, or you can request white papers or primary data from us at any time at info@teefhealth.com.
Awesome. Thank you so much. And everyone, just don't forget to follow, subscribe, and leave reviews. If you found this interview interesting, be sure to share it with your loved ones and fellow cat owners. This will all help us to reach more cat owners who would also benefit from this info. Thanks, Emily, again for your time.
Thank you, and thank everybody for listening.